Hi everybody, this is Dr. Ravindran Kumeran. I'm a surgical gastroenterologist practicing in Apollo Firstmed Hospitals, Pundumalai High Road, Kilpauk. Now we are going to discuss about what hernia is and how we diagnose it, right? So what is a hernia? Hernia is nothing but a protrusion of organs within an enclosed cavity, right? So abnormal protrusion of an organs from an enclosed cavity. So the common site of hernia is the abdomen. So abdomen, at least in the front, is only covered by muscle. So when there is a defect in the muscle, things from inside such as fat or intestine or colon can try and come out through that hole. Yes, it will be behind the skin, but you can see that there is a bulge. So that is what typically a hernia is, right? Hernias can happen in various regions. The very common places that we day to day come across is the belly button is one. The second very common one for men is the groin, right? What we call as an inguinal hernia, right? So other very common site of hernia is previous scars. So any scar in the abdomen, whatever surgery that may be, is a potential weak point through which a hernia can occur. So if that weak point gives way over a period of time, I'm talking about several years here, then that is also referred to as a hernia. So how do we diagnose this? See, usually it is a clinical diagnosis. If you have a competent doctor examining you, then often he or she will be able to tell if there is a hernia. Rarely you may require an ultrasound scan or a CT scan to have further details about the hernia. Sometimes you can have complicated hernias, especially hernias which have come back after previous surgeries. Sometimes you have patients who had several surgeries in the past. You really don't know what the anatomy is like. So you may require some kind of imaging such as a CT to have clarity as to what it is. So on those occasions, those investigations are appropriate. What kind of symptoms do these patients present with? Often it is simple, straightforward. Patients say, I've got a little bit of discomfort, or I've got a swelling in an abnormal place. Doc, I never used to have a swelling in my groin. Now it looks like when I stand, I can see a swelling, is the usual story you hear. Or you have a patient come back saying the particular scar is kind of becoming more prominent, what the problem is. Now this is how patients come to your outpatients and see you. You can also have emergency presentations. Patients are not aware that they've got a hernia and they come for the very first time with the obstructed hernia. What do we mean by this? So you've got a hole through which things are coming out and going back in. As long as that is happening, it is fine. Sometimes too much may come out through the hole and get stuck. And if it happens to be the intestine, then often the intestine gets blocked. So patients come to the hospital not realizing what it is, but they will be throwing up. They will not be having any bowel movements. They will not be passing any wind. So they come in typically with intestinal obstruction. And when you're trying and evaluating the patient for intestinal obstruction, you figure out that it is because actually there is a hernia in which a little bit of bowel is stuck, right? So that is an emergency presentation. Emergency presentations are often tricky to diagnose, especially if the patient is not able to volunteer the symptoms properly. And if they are not saying, I've got a swelling here, sometimes they can get easily missed. So it requires a little bit of careful history to be able to pick up these problems. Thank you.